This week on the Delaware Way, the Lieutenant Governor, Bethany Hall-Long, says depending on how the census goes, we may get another representative in Washington. This is the Delaware Way. Welcome to the Delaware Way. I'm Larry Menti. One of the monumental tasks in Delaware has been fighting the opioid crisis, and leading the charge in that battle is our next guest, Lieutenant Governor Bethany Hall-Long, who is also the chair of the Behavioral Health Consortium. We talked about it last time you were here and what needed to be done. Since then, I see you have a report in your hand.
Yes, I have the Behavioral Health Consortium 3-year action plan, and when we had met before, we were talking about Delaware's experience with mental health issues and substance use disorder issues, and how in Delaware, you were spot on, we have around 30,000 adults, 9,000 children who have serious mental illness or substance use problems. And we put together a fabulous consortium of 17 members statewide, people from the community and experts, not bureaucrats, but persons who understand this. And we were able to take that plan statewide. And we went out in community forums with over 600, it was so amazing, 600 residents who came out to talk to us about issues. And the one you hit spot on is the current pressing issue of addiction. Although keep in mind, when you talk behavioral health, you're also talking issues of autism to the end of life, Alzheimer's.
Oh no, I understand, and I was going to get to that, and I started the show the way I did on purpose, because I understand that the mental health concerns are enormous, and if you have a child in your house with autism, that's your top concern, not the opioid crisis. But the opioid crisis has been, people have been dogged in trying to beat it. Money has been poured by the federal government, by the states, and by municipalities, and yet, as we see in many states across the country, the overdose rate keeps going up.
Right. And that's why we're really pleased to be boots on the ground, and all eyes are on small Delaware. You'll hear other states have had maybe a year or two ahead of us, but when I served in the Senate and others, we started with some legislation looking at things like the antidote to heroin with the opioid Narcan, the antidote to that. And what we've been able to actually do is, based on this community statewide plan, the Pew Charitable Trust selected Delaware this year as one of 2 states that they're looking to be a model for other states. So we're really excited about that. And just last week, Congressman Patrick Kennedy was here in Delaware, and we signed off on mental health parity, which is insurance access. We recognize insurance as an issue. We know our Attorney General and our Insurance Commissioner and others have been looking at that. However, we know there's much more to be done around mental health parity. And so when we came up with this plan, it was really exciting because we were able to identify 6 committee areas of real focus. One dealing with stopping the bleed, which is, as you stated, the death and the overdose. So that's looking at access and treatment. And we have emergency room physician, Dr. Sandy Gibney from St. Francis, who's leading that with a retired former leader of Youth and Family Services, Susan Sissick. And they are out in the field every day. We're working to identify persons who need access to Narcan. But we're doing more than that. And just yesterday in Delaware, Governor Carney signed 3 big pieces of legislation, one of which makes Delaware the first in the country with an overdose system of care. And all eyes are on Delaware.
This what you're talking about is huge, and it's been one of the big loopholes across the country. We do shows in other states too, and it's one of the big loopholes across the country that people come in for care, people come in for an overdose, or they're brought back with Narcan, and then they go right back.
Right.
And there's no treatment for them, and there's no insistent on treatment, or somebody there to say, you need treatment and get to this. And this closes that loophole, right?
Right. Well, we're starting. That is going to close the loophole, getting people treatment when they need it. So our law enforcement officers, our paramedics, our EMTs, when they do arrive at the hospital in the ED, to make sure that there is accessible treatment and follow-up treatment, and making sure that there is that appropriate coverage. So yesterday we signed the overdose bill in place, and we're working really hard too with prescribers. We're continuing with our addiction action work to make sure that persons have alternatives to pain prescriptions as well, whether it be chiropractic or physical therapy care. And like most states, we have the prescription monitoring. And so yesterday we expanded that so we can identify. So we know where in our state, whether it's down in the Seaford community or here in northern Wilmington.
Yeah, one of the things you said, you have boots on the ground, and you talked about Narcan. You walk the walk. I saw the video of you out in the streets with Narcan, giving out Narcan.
Yeah, well, you know, we're doing that through our great programs, through partners such as Brandywine Counseling, Dr. Gibney, and others. We've been out on the street. And ironically, when we were in Dover, we came across a woman who had actually overdosed, and we were able to administer her the Narcan and to follow up. And I think from these models, what we're looking to do is find out what are those real barriers and how can we actually get people into treatment. And so Pew and others are following Delaware so that we can be that model, and also to be looking at issues of prevention. Our emergency rooms and our prisons are places where we have persons kind of captive, and we don't want to miss that golden opportunity, like you stated, to make sure people get the treatment. You know, we were talking yesterday that when someone has a heart attack, they just don't go to the hospital to get an aspirin and then we send them home. Well, we've been doing that far too long with persons who've suffered from an overdose. And the great news about the Narcan going into the community, it's not been with taxpayer dollars. It's been donated Narcan, and we've been able to save people from the long-term consequences, such as, you know, brain hypoxia, ending up in a nursing home bed. And so it saves taxpayer dollars. So it makes a lot of sense, not only for taxpayer dollars, but for quality of life, for us to get to persons early on with a Narcan.
I know the consortium dealt with much more than opioids. Thank you for focusing on that for now. Let's talk more about this study when we come back. And I also want to talk about your other endeavor, and that's you're running the census effort in the state as well. So we'll talk about that when we continue our conversation with Lieutenant Governor Bethany Hall-Long when the Delaware Way continues right after this.